Hi, I'm Stephen R. Ash, MD, of HemoCleanse Incorporated, and also Indiana University Health, Arnett, where I'm a practicing nephrologist. With the help of Mr. David Carr, we've developed a model that will help to train young physicians who are interested in placing internal jugular dialysis catheters by ultrasound. The IJ ultrasound model is rather simple to use and highly realistic. I'll give you first an overview of components. This is the torso of the model, and this is a simulated skin. The simulated skin has two entry points where you can actually tunnel the catheter under the skin before advancing the tip into the internal jugular catheter or vessel. Underneath this skin is a neck portion, which I'll show you shortly. Other components include a water reservoir holder, and this holds a water reservoir that replaces fluid water within the neck during the use of it in actual catheter placement. There's also a side bottle that has a small amount of water that's used to simulate saline during the catheter placement. Additional components include a neck reservoir tube that connects the reservoir bottle with the neck model, and also a heart valve and tube that will change the pressure within the simulated carotid arteries during the ultrasound placement. I'm going to show you the components of the neck portion first. Next. This portion has within it a simulated vena cava on the right side, a simulated innominate vein, and simulated internal jugular and also carotid vessels. The vessels themselves are included in what we call the vascular insert, which is held into this cylinder by these three clips. Within the vascular insert is a simulated spine, a simulated internal jugular vein, right side, right side, and two carotids placed just slightly medial to those. These are all visible under the ultrasound probe. Also on the neck is a subcutaneous layer, we call it, that actually keeps fluid within this neck model while we do the ultrasound. It's held in place by this door that tightly seals it. And this is what will be penetrated by the needle on the way going into the internal jugular vein. There are, of course, latches on the door. You should leave those closed unless you're going to replace the subcutaneous layer. After we fill it with water, we'll be inserting the vascular insert thusly. In regards to placement and replacement of all of these components, just see the manual. The next step in assembly is to fill the neck portion with water. This is easiest done in a sink because there will be some overflow when the vascular insert is placed within the neck. Put the neck portion in a sink. You'll fill it with about 1,300 milliliters of water, or to a level just above the top portion of the simulated subcutaneous tissue. Then you'll take the neck insert. Notice there's a hole on the bottom part, and this hole aligns with the simulated spine within the model. Lower it down slowly into the neck model and push it closed, and then clamp these three clamps to firmly attach the neck to the vascular insert. At this point, by the way, you can inspect it. There should be no gross or visible leaking from the simulated subcutaneous space. Next, we install the neck portion into the torso. We lift up the torso and slide the neck downward. And there's a rod that interfaces with the spine portion of the torso. interface those two, and then slide the neck portion into the model, making sure that the latches are on the side, and keep advancing it and give it a slight twist. It'll stay in position because there's a screw in the bottom that centers it and keeps it from rotating. The next thing we'll install is the heart bulb and pump. We fill these with water before installation, and it can be done with the reservoir or this little side bucket. It's actually easier from the side bucket. Just hold the bulb upward like this. Squeeze a few times to eliminate the bubbles. And then take the tan portion connector and slide it into the tan portion connector on the neck called artery. This will supply the varying pressure to expand the carotid vessels during the ultrasound picture. Next, we have a water reservoir. This should be filled about 3/4 full of water. And we'll install the neck reservoir tube, the L-shaped piece, into the connector on the top of this reservoir. Invert the reservoir and put it in the reservoir holder, making sure to keep the tubing from kicking at that point. And then clamp this off once the tube is filled. At this point, we connect this portion of this reservoir tubing into the white connector at the top of the neck, and then unclamp the tube. Next, we will demonstrate the placement of a catheter. You can use almost any chronic tunnel dialysis catheter. This happens to be a Centros catheter from Merit. And the components of the kit you're well familiar with: the catheter, which has already been pre-filled with saline, a split sheath for placement. That goes over the guide wire after dilation by these two dilators, and there's an 18-gauge needle. You can also, of course, use a micropuncture kit before putting in the 18-gauge needle. To start the procedure, it's a good idea to lift the skin up and apply a thin layer of gel between the skin and the subcutaneous layer. Just kind of rub it around a little bit. And then, choosing the place where you're going to do the insertion, put some more gel on that part of the subcutaneous layer. The ultrasound probe should be grabbed with one hand and then used to demonstrate a picture on the ultrasound screen behind us. Under direct vision, you'll place the 18-gauge needle and advance it until you see the jugular vein begin to deform into a heart shape. At that point, push it through until you see a recoil. At this point, you can see the needle point within the vein. There will be a slight exit of fluid, in this case rather than blood. You'll advance the guide wire in through the needle. There will be no resistance to advancement of this. Up until about 30 centimeters when you run to the bottom of the vena cava. And then you can pull the guide wire, the needle back over the guide wire. Just like in a patient, you should always then confirm the position of the guide wire within the jugular vein. I think you can see that the guide wire moves back and forth easily. If you keep rotating, you can see that it stays within the vein, but at the back portion. Incidentally, by comparison, here's the carotid artery. Or in the reverse view, this way. Okay, next we'll plan to tunnel the catheter under the simulated skin and place the cuff in position where it will fix the catheter. There are a variety of tunneling tools. Each of them is made specifically for a particular catheter. For the Centros catheter, it's a little longer than usual because it works just on friction. This catheter is inserted into this guide. You can position it with the arterial side basically so that it ends up on the left facing the left in the patient. After you have advanced the catheter into the tunneler, you can also bend the tunneler. It's best to do that after you advance it so you don't mess up this nice tapered tip. Now we have pre-made some slots here which indicate an incision underneath the skin. Beneath the skin there actually is a piece of Velcro here. You insert the tip of this tunneler underneath that Velcro and advance this. And you hear a slight crinkling sound, and you also find some resistance. You can then pull the catheter through the tunnel in the same manner you would for a catheter underneath the skin, and you're aiming for this initial skin exit site which has been created. You can then pull the cuff underneath the skin, and I advance the cuff all the way in towards the clavicle, allowing the hub to be very close to the skin. That allows you to secure it very well with sutures. You can then take the tunneling tool out. And the next thing we will do is, of course, get the tip of this catheter down into the vein. To start that, we have dilators. There's a smaller dilator, about 4 millimeters. This is advanced around the catheter. The guide wire, sorry, and placed through the subcutaneous tissue and through the jugular vein. You'll feel a slight resistance as you go through both layers. We then have a larger catheter, about a 6 millimeter. This is placed again over the guide wire and dilates through the subcutaneous layer and through the jugular vein. Then finally we have a split sheath. There's various manufacturers of split sheaths, but none of them come with the dilator already in position for use in placement, because otherwise that would mess up the valve. In this particular one, it's a slide valve. You slide this over, then reinsert the dilator through the valve and lock it in place. The split sheath is then placed on the guide wire and advanced just like the previous dilators. First through the subcutaneous tissue, then through the jugular vein, and I advance it pretty far. After advancing this down to within an inch generally of the subcutaneous and skin layer, you can then loosen the dilator and take both the dilator and guide wire out. The valve at that point holds back most of the blood, or in this case most of the water. Now for placement of a catheter, the first thing you want to do is just make sure to get the venous tip in through the valve, then worry about the arterial tip. So grab the venous tip, shove it through the valve, pinch the catheter together, and slide it down through the split sheath. Put it down as far as you can go. There's lots of ways to accomplish the next step, but what I do is split this. Make sure the catheter is down, again, as far as it will go into the split sheath. And then use a finger on the catheter to keep it in position as you pull the other two portions out.
Stop in the middle so they can see.
An assistant can serve for the middle finger if you wish. At that point, the catheter is within the jugular vein and superior vena cava. And as you can see, there's a gentle curve and no kinks. Normally, of course, in placements of chronic catheters in patients, we use fluoroscopy to note the advancement of the guide wire, the advancement of the dilators, and the split sheath. In this lab, we don't have a X-ray machine, So I thought I would take a glance at the catheter using ultrasound and show its location within the vein, curving down towards the vena cava. That's the catheter right there. For those who are really curious, you can actually remove the skin portion of the model and pull the neck portion back to demonstrate exactly where the tip of the catheter, venous and arterial, ended up in the simulated vena cava. As you can see, it ended up with the arterial tip to the left, as it should be. Now, had we placed the catheter from the left side through the left IJ, we purposely put in this innominate vein. So the placement of the guide wire would create in some resistance at this bend going into the innominate and at the other end as well. Also, advancement of the split sheath would not be possible. It shouldn't be done quite as far as in this model on the right side. You can still place the catheter, but you teach people to feel more carefully on the left side for the expected deviation of the guide wire course. This model may be used for placement of approximately 20 internal jugular catheters with the split sheath on the right side and another 20 on the left side. After that, we recommend replacement of the subcutaneous layer and the internal jugular vein simulated section. So basically you can use it all afternoon and demonstration after demonstration. I'll show you next how to take the model apart, basically. It's probably easiest to lay the skin backwards. And then the first thing we'll do is remove this catheter from this subcutaneous layer. You can then remove the catheter directly from the simulated skin layer. You can take the tube off from the common reservoir, or the artery, and then empty this back into the side container. And you can also remove the tube from the reservoir. But when you do, you should clamp the tubing, because there's no check valve in this system to keep it from emptying itself. Then finally, you can remove the neck. Again, a sink is convenient, although if you don't have a sink and you're reasonably careful, you can pour excess fluid into a bucket. So what you'll do is remove the vascular segment by undoing the 3 clamps again. Pull it out, and it will itself drain fluid, not only from the jugular veins, but also from the carotid arteries. Shake it a little bit. You can then pour out the fluid. And then we recommend that you dry all of the components, basically before letting them set to air dry. You can then package it up and be ready for the next demo whenever you wish. Thank you very much.